Hi everyone, welcome back to my channel Nursing Guru. In this video, I am covering the key topics which are focused in NORCET-7 question paper. Watch this video completely to know the important topics covered in NORCET-7. NORCET-8 is just near and I know you are looking for the most important topics to focus on. I know how stressful preparing for NORCET-8 exams. So I have broken down the key topics for you which are absolutely need to know. Okay, let's get started. Here, I will narrate the major topics covered in NORCET-7. Listen carefully and plan the preparation according to the topics. First, they asked some MCQs from Basic Life Support and Cardiopulmonary Resuscitation, that is BLS and CPR. In that, they asked MCQs on compression to ventilation ratio and airway management, that is nasopharyngeal airway contraindications, and they asked some MCQs from nasal intubation also. Then second topic they covered is cardiology and ECG interpretation. In that they asked types of deceleration in cardiotochogram, ECG changes in hypocalcemia and hyperventilation. They also asked MCQs on normal QRS complex interval, then identifying some arrhythmias like atrial flutter, atrial fibrillation, etc. Then they focused on respiratory care, that is oxygen delivery methods and their flow rates, complications of high flow ventilation, indications of suctioning and catheter sizes, management during hyperventilation like paper bag breathing, etc. Then they focused on electrolyte imbalance. In that they asked symptoms and management of hyponatremia, hypocalcemia and hypokalemia. Then from major MCQs asked from maternal and child health. They focused here on management during labor, that is second stage management, ABC protocol, then Apgar scoring and neonatal care. They focused also on feeding methods for children on CPAP and complementary feeding options for toddlers, then identifying types of dehydration. In pharmacology, they focused on drug administration routes like Z-track method in intramuscular injection, then dosage calculations and flow rate conversions, then extravasation causing drugs. Then they also asked some MCQs on contraindications of some medications and some specific conditions. Then they focused on some infections and public health. In that they covered WHO declaration on COVID-19, then hospital acquired infections and prevention, then some danger signs in sick children, that is according to IMNCI. Then they asked some MCQs on emergency and trauma management like triage protocols, management of kerosene poisoning, oxygen delivery for RTA patients and cardiac arrest intubation techniques. Then they also focused on surgical and post-operative care. In that, mastectomy post-operative care, prevention of bed sores from endotracheal tube placement, then lumbar puncture positioning. Then some general topics also they covered. Then that means the miscellaneous topics are behavioral therapies like relaxation for stiffness and pain, then identification of some instruments. Here they asked Alice forceps, then body temperature measurement methods. They also focused on endocrine conditions and blood transfusion protocols. These are some major topics they covered in NORCET-7 question paper. Please go through my NORCET-7 question paper solved series. If you found this video is helpful, please subscribe the channel and hit the bell icon for regular updates and support my efforts by liking and sharing my videos. Thank you. Then if we see specific topics, they asked some MCQs from infectious disease and causative agents, like they asked Lyme disease, meningitis, enteric fever, then physiological jaundice in newborns. Then from patient assessment and clinical signs, they asked signs of severe dehydration in infants. They asked orthopnea, ECG interpretations, as I told, atrial fibrillation, hyperkalemia. Then assessment of ICP, that is increased intracranial pressure in infants with VP shunt, ventriculoperitoneal shunt. Then from OBG, that is from obstetrics and gynecology, they covered or they asked some MCQs from calculation of GTPAL score for obstetrical assessment, fetal lung maturation, then induction of labor indications, then breastfeeding initiation and kangaroo mother care benefits. Then from emergency and critical care, they asked types of shock, example hypovolemic shock they asked. Then they asked CPR techniques and ratios for children and infants, management of severe bleeding and anaphylactic shock. They focused on some drugs which are used in anaphylactic shock, like adrenaline dose, etc. Then from emergency and critical care, they asked also regarding management of burns, that is Parkland formula, fluid choice and all. Then from pharmacology and medication administration, they asked sublingual nitroglycerin for angina pectoris, digoxin toxicity and associated electrolyte imbalance, that is hypokalemia. Then they asked some injectable contraceptives like DMPA. Then they also asked side effects of antipsychotic medications like haloperidol, which causes akathisia and all. Then from surgical and diagnostic procedures, they asked contraindications for liver biopsy, surgical safety checklist, catheterization, then lumbar puncture and CSF analysis in bacterial meningitis. Then from pediatrics and neonatal care, they asked normal hemoglobin levels in newborns, phototherapy for neonatal jaundice, then stunting in children. They focused on height measurement tools for children. Then from community health nursing, they focus on infant mortality rate as a sensitive index for community health. Then they asked long-term effects of high blood pressure, example heart attack and all. Then they covered some miscellaneous medical topics also, like Weber test for hearing loss, hand hygiene movements according to WHO guidelines. Then glutaraldehyde used for sterilizing heat sensitive instruments. Then occupational lung disease, etc. These are some specific topics they covered for MCQs.